Welcome, Culturati community. In this session, we're going to talk to the experts on empowering workforces to be well and productive. After a year we just had with the pandemic, it's no small task to holistically address the well-being of your people. Hi, I'm Matthew Duncan. As a Culturati strategic advisor, my role in the culture movement is to be a catalyst at the intersection of human performance and technology. I've dedicated my work and energy to wellness, innovation, the employee experience, and most critically, the future of work. Today, I have the pleasure to be with some of the leading innovators in the industry who are bringing forth advancements in technology, behavioral science, and coaching to support and lift the physical and mental well-being of employees and the larger community that we live in. So welcome, panelists.
Thank you.
So let's go around and just do a quick introduction. Joshua Templeton from Aduro, you want to start with us?
Sure. Good afternoon. Thanks for having me. My name is Joshua Templeton. I head up growth for Aduro, and just a little bit of my background in our organization. Aduro, for context, is what's referred to as a human performance company, which is, simply put, it's when well-being and an individual's performance intersect. And that's where you really start to see that true flourishing that many of our clients love to see within their employees. What I also love about what we do is that we certainly interact and leverage our own technology each and every day. And I'd say through the pandemic, I have certainly taken advantage of coaching and development and how to be a better parent and how to navigate through all things pandemic. But it's also given me some really great tools and resources that I've been able to leverage with my clients and my own family and friends. So super excited for our time together today, and very much looking forward to it with both Jennifer and Brad and yourself, Matthew.
Great, welcome. Brad, do you want to do a quick introduction?
Yeah, sure. My name is Brad. Last name is Lande-Shannon, and I am the Chief Marketing Officer at Spring Health. And Spring Health is a mental health benefit, and we remove every barrier to mental health. As we all know, the last sort of year plus that we've all survived, our mental health has really taken a toll. So we have seen really incredible explosive growth, but our business model is really to deliver the right care at the right time. So we have clinically proven strategies for establishing care plans for people that are highly personalized. And that includes therapy, psychiatry, and also coaching and some other more subclinical solutions. And my background, just a little bit more about me, as I was running marketing at Culturati before this. I'd say for the past decade or so, I've been really focused on the workplace culture space. And I'm just really excited to be at Spring Health, where we are really living at the intersection of how mental health impacts our workplaces. So super excited to be here and to talk about this.
Great, welcome. That's a great applicable background. And Jennifer, will you share a little bit with us?
Hi, Jennifer Sargent. I am Vera's Chief Commercial Officer. Vera Whole Health, we are a leader of advanced primary care solutions and really using primary care as a way for members and employees to access a system that helps them manage their whole care. We call it whole person care. So we take a biopsychosocial approach to how we make sure members, I love, Brad, what you said about getting the right care at the right time to support them both physically with social determinants of health as well as behavioral health.
Excellent, excellent. Well, I think we span all aspects from well-being to mental health to care. So let's kick off the questions with talking a little bit about this crazy year we had with the pandemic and the fact that it's truly impacted people, right? We're definitely heading into a new direction as the COVID vaccine will be available to all eligible adults by around May 1, as we're hearing. And we're beginning to actually turn the corner onto this new hybrid workplace. So why do employers even need to care about wellness at this point? Jennifer, you want to start us off?
Yeah, I'd love to. It's a great and very relevant question. And I think as we look at journeys that employers have been on in the past many employers have focused on the well-being of their population, but I think it's traditionally been around how do they make their employees well at work, right? How do they try to fit, life around work? And I think we can all agree that the past year has flipped things on its head, right? The lines between work and life have blurred. The way that we work has changed. The things that we've all been facing on a day-to-day basis have changed. And I think employers are starting to realize that now it's really around how do you fit work within your life? And employers need to start thinking about, from an employee retention and engagement perspective, how do they provide the support to their employees and now their families to really figure out how to make work a part of their life, and be healthy and well and productive at the workplace. And I think over time we've always struggled to define like what's the ROI on wellness or well-being. And I think right now we can all agree it's just so apparent how important it is for us to have workers that can even show up and be productive, health, and happy. We really need to support them in this new flexible environment.
Yeah, I couldn't agree more. Josh, from your perspective, how are you seeing sort of organizations define wellness, especially as we move into this new work reality?
Yeah, I think, Jennifer, the comment you made at the end there, right, around, the world at home and the world at work have kind of collided together is I think, a great example of, we have such a different workforce now. And so when you think about, what employers are really asking of the partners that they're working with in the market, which ultimately provides the types of resources that are available to individual employees, right? Now we have situations where, if you're looking for counseling or therapy or any form of clinical support, 1 out of 10 counselors are taking new patients. And so, okay, I'm stressed or I'm anxious because I've got all my kids going to school next week. Well, maybe I want to talk to a different resource, or maybe I need some coaching or guidance. And so what happens is, as these organizations are trying to figure out, like, how do they provide the right type of resources, we're continuing to have change. And so what's happened is at an organizational level, we're seeing our clients really take a step back and look at well-being in a very different way for all of the things we just talked about. Change, everything's now commingled in one. People are now navigating a new world of stress. People's lives have changed foundationally. And so what we're seeing is organizations are actually uncoupling, if you will, the idea of a traditional well-being program, and they're getting it away from directly tying it to a overarching benefits program and saying, we need to make this its own thing. This needs to be able to interact with our employees 365 days a year. We need to not only tie this to that beginning part of the year, but what about the summertime now? And how do we prepare people for that lull when they've been with their children or maybe themselves throughout the year, and now they have this lull in the year? And then how do we get them ready for the fall? And by the way, COVID-19 could potentially ebb and flow as we continue to ebb and flow. So what we're really seeing, Matthew, in your question is, we're seeing organizations look at wellness and well-being very, very differently. They're looking at it as, how do we engage and create ignite moments within our population so that they know that they've got the tools and the resources to actually navigate this. And then last but not least is, when you think about the culture part of it, is we spend a third of our lives working together. And so what better time to reprioritize how you think about your people than right now? So it's a little bit what we're seeing. And I think it kind of ties in nicely to what Jennifer and Brad started off with at the beginning of our time.
For sure. I mean, it's truly becoming this cultural imperative, and it's become a priority from the C-suite down. Well, one of the questions that I often get asked, especially even in the recent sort of CHRO panel that we've had, was around measurement and monitoring. So how do we actually do, and have we gained enough knowledge to truly measure and monitor sort of the progress for well-being? Brad, you wanna take this one?
Yeah, sure. I also just want to segue from the conversation we were just having, because I do think that it's really important to acknowledge the fact that there are systems and there are things in place today that are not working for our organizations. And part of what I want to share is my own personal story, which is I moved from San Francisco with my husband and my 4-year-old in March or April, from San Francisco to Portland. And I was moving as, has some stress associated with it. And it was about 30 days after we moved that Oregon was hit with the wildfires. And my family was evacuated. I got the notice on my phone. The phone was beeping. I still have boxes we haven't unpacked. There's this moment that I was like dealing with a crisis, and I was high performing, productive, like leader of a team. And when I reached out to my HR leader, by the way, one of the most culture centric organizations today, Culture Amp, we sell the culture, the product. When I reached out to my HR person, I was sent to an EAP phone number. So I called this phone number to try to get therapy. And of course, I called 5 people. One of them called me back to tell me that they didn't have time for me. And the reason I think that story is so important is to highlight, like, thank goodness I had other tools. I had access to other means. I had friends who referred me. I was privileged enough to be able to afford private care. Like, not everyone is in that situation. And so I think the importance of this is it's gone from a conversation that people are having in the benefits room to the boardroom. And if you're not dealing with mental health and you're not thinking about holistically how your employees are doing and how you're supporting them, you are really missing the boat here. And I have never seen it more prioritized. And it's part of why I transitioned my career from just culture to this particular category, because I found that it was one of the most impactful things to helping to improve the culture, was giving people the ability to deal with their own individual challenges. So that was a little bit of a segue, but to answer your question about metrics and how are we measuring the success and the impact, I think one of the things that we do at Spring Health that is really, really powerful is we can give you data in aggregate. So looking at your employees, what percentage of them are dealing with depression, with ADHD, with PTSD, the most common challenges that people face, and then how does that change over time? So are the programs you're doing, is it getting people better? Do you see people in recovery? And so, like, really looking in aggregate, there's a lot of, platforms and tools, and thank goodness there's a lot of new companies that are spinning up every week. And I think that there is a lot more that we are able to measure and track. And as an HR leader or a senior leader in an organization, the access to that data is available if you have the right partner. And it is important to quantify this stuff so that you can see that those percentages are changing over time, and that the impact to your organization, we'll talk about this, I'm sure, later, but also can be felt in engagement scores and other things that you can look at that could be tied to some of those mental health metrics.
That you mentioned one thing around just the systems that play into actually supporting the people. And so I want to segue a little bit into the questions we often hear from the Culturati community around, help me understand a systematic approach that really starts to drive towards a healthier, both physical and mental, healthier existence for our population. And Jennifer, maybe you can talk a little bit about how you think about that systematic approach and how you would share that with a senior executive.
Yeah, I love using the word system, because asking our employees and our members to navigate just the healthcare system alone, not even thinking about like their own lives, can be so complicated. And I think oftentimes employers can get themselves into trouble by offering so many great benefits without putting the system in place to help their employees navigate through those benefits and get to the right place at the right time. That's one of the reasons why we believe something like primary care at the center is such a great way to build a system around it, because you give the member one place to go with a care team that then can help them with the reason that they're coming in, and then get them connected into wherever else they need to go, right? So many of our clients will use other firms like Brad and Joshua's, and we can get the member in, help them with their problem, and then potentially navigate them out to an additional benefit or try to serve their needs within the system that we've built. And if we think about the stress around just navigating healthcare and even COVID itself, I'll share a little personal story as well. I had a baby last year during the pandemic. And so trying to navigate what that was going to be like, I thought 3 weeks before I might have COVID. And so I was trying to figure out, like, where do I get a test? And I'm trying to call in places. And I ended up, picking up the phone and calling internally into my organization to my care team and saying, please help me, because I don't need the added stress of this right now, right? And several other examples throughout that journey for me. It's just really about giving them a place to go to help them navigate and get the right care. So building a simple system is really important to think about.
Can I just, I think a real quick comment, Jennifer, and I think it's a really important one when you mentioned the physician, that primary care physician really at the center. When you think about it, one of the interesting things we've seen over this past year, and this is true, I mean, if you look at many different data points, for all intents and purposes, people haven't gone and seen their doctor in many instances for over a year now. People were scheduling annual physicals in, March and April and trying to get it on the books, and they weren't seeing their doctor until December, January, like literally right now. And then you think about what you said, which triggered this in my mind, which was, where do most people generally have that introductory conversation that they're stressed or there's anxiety or a number of different things they're thinking about? It's with their primary care physician. It's the first question they generally ask. Josh, tell me what's new with you. Mm-hmm. And so I think it's such a great call out, which is like, how do we help people get back to that place? How do we help them get to a place where they can, it's almost like we're playing catch up right now. And Brad, I think I just wanted to say as well, like, that makes total sense. Like, you're in the same boat that everyone else is in. You're in this moment of stress and anxiety. You and your partner just moved. There were the wildfires in Oregon. You're playing catch up. So I just wanted to hover on that for a second, because I think it's such a great point, right? Which is, how do we help people get to the place where they can start identifying that they need support? And then to your comment, Jennifer, routing them in kind so they can get access to those resources.
Mm-hmm.
One of the other things that came out when we reached out to our community of culture leaders was, of all the people that they felt really needed support in the organization, were frontline and middle managers. There was this unnatural sort of evolution of new responsibility that they had to take on and were burdened with, going from just managing their teams and their outputs to now actually having to basically coach and care for these people. And they just didn't have the experience. And so we've gotten a lot of inquiries about, how do we support our middle managers in a new and sort of effective way? Who would like to address that?
I can take a part of it, which it's interesting, having moved from Culture has an engagement survey, and we measure the health of your culture, and so there's a way that you're checking in with your employees and you're getting a pulse, which is really important. But I think what this comes down to is, like, where the rubber meets the road is the relationship that managers and people have with their teams, the one-on-one relationship. And that one-on-one format is like, you show up, you go through your projects or whatever. Any good manager has a regular one-on-one cadence. I think the thing that is really important to remember is that how are you spending that time? Like, what are you actually talking about, especially when things are going on in the way that they have been for the last 18 months, whether it's the pandemic or social unrest or the Capitol, or, fill in the blank. Like, there's just been so much. And so I really, as a leader of other teams, is to make sure that you're using that time to provide space to have real conversations, not just about how's the project doing or how are things moving forward. So I think that's like one way to answer the question. I think the other, which is part of why I feel like this business model that we have around mental health is so important, is like, we're all not equipped to deal with all the challenges. As great of a leader as I am, and all the training that I've had, there are many, many, many times that I am out of my depth. like someone who is dealing with depression or who has had a really, really rough time because someone has died in their family or postpartum, like these are real issues that we are not equipped to deal with. And so I think it's really important for people to know that there are tools and there are things that people can go to outside of the bounds of their role as a leader. And that's where I think there's just proliferation of all of these great companies, which I think is such a wonderful thing for our society at large, regardless of some will win and some won't. At the end of the day, it's a really important moment. And I'm really thrilled, for humanity, quite frankly, that we have more of these things. Because when my parents were growing up, like you didn't talk about this stuff at work, like you definitely didn't. And so I think it's just to be aware, like get aware of what your company has as a leader. Like it doesn't matter whether you're in HR or not. If you are facing things at your team, that are out of your depth, to really make sure you're leaning on HR to say like, I need support here. And I want to say that because I think a lot of the people who are probably part of the Culturati community have their heart in the right place. Like they really care about culture and they want to do the right thing. And sometimes the right thing is to say, this isn't my zone. Like you need to get other help, And I think that that's a really hard thing to come to terms with when you're a seasoned leader who cares about people. And there are many cases where that really is the case.
Brad, I really appreciated your comments and really the importance of making sure that as a part of your culture that you're really making it a foundation to make time and space to have the conversations. And that really starts from the top down. Right? I mean, the top leaders of an organization need to be asking those questions of their people, asking them if they're asking the questions, right? I mean, I feel like in the past year, I have gotten to know people at work on a deeper level, even though I haven't seen them in person. I'm not in the office with them. I'm not traveling with them. And I think it's because we've been forced to get personal part of the time because it comes, screaming into our virtual meetings and our kids are running into the room and so you start to see people and learn more about their personal life and open it up. But I think really just from the top down, making sure that you're setting this foundation that it's okay to have those conversations. At Vera, part of our foundation, the foundation of our culture is one of empathy. And really approaching all of the interactions that you have with empathy. And really thinking about what is that person facing, and Brad, to not make it about let's just start talking about the project. Let's talk about what's happening with you. I think that those are really great words. Thanks for sharing that.
One thing I would just real quick, Matthew, I was just going to add on is, what's interesting if you think about it, we're doing something that has, in most instances, has never been done before. We're hiring and building teams, and we've never actually met these individuals. And so when you start to think about, right, building that authenticity, Brad, the comment you made a second ago about, when your parents were working, right, these were things that in most instances, we were in many instances trained to not talk about. So the real question is how are you equipping your people and your leaders to hire, onboard, work with, and drive amazing experiences? And as we all are doing this presentation and this session, and you're doing it virtually, the real questions are you training your people to be successful? How are you doing that? Are you giving them the tools they need? So to your point, Brad, if they get to a place in their journey where they go, whoa, this is more than what I know how to handle, right, that you're putting them in a place to be successful. So I think it's the comments you both made, I think are really important. And the real question is, right, is how are you training your managers and your leaders to not only navigate that, but to be able to handle it and do it in a really great way?
Are there
I just have one quick tip, which could be very simple, but it has really changed, I think, the quality of the conversations. Is there's a line item in every one-on-one agenda that I have, which is rate your current well-being state, on a 1 to 5 scale. How are you? And why I like that, and we always talk about it, is stuff comes up there that I would never not know about. And so you're asking people to track their own well-being. You're also saying it's important enough for us to spend time on it and for me to know what's going on with you so that I can think about load balancing of projects and what is the thing that I might be able to do to support you. So that's a really small thing, but it can change the tone of the conversation in one-on-ones.
So I'd like to switch the conversation a little bit towards this concept of innovation, right? So we're really getting into some realities that is facing us in our work and life environments. As innovators, what new technologies or service advancements are you seeing out there that are going to change the personalization, that are going to help, sort of move to a more empathetic or sort of engaged set of members inside your organization? Who wants to take that one?
I'm happy to just share a little bit about what I think is happening in the more macro environment around artificial intelligence or machine learning. And I think one of the things, that hopefully we are all more aware of now than we were before 2020 is systemic racism and like what is actually built into the systems that we are all a part of. And so what I think is really important when you talk about care and healthcare is that there are biases that are built into a lot of our models, and we are not even aware of it. And part of that is because a lot of these models were built by white men. And I think it's really important to raise that point. And what I think can happen, and the power of AI and machine learning, is that it can point us to what those models are doing and where the inaccuracies lie. And so I think that we're at a time when technology can really start to point us back to our humanity if they're used and they're leveraged in the right way. Now, if we're blind to it and we pretend that machine learning also isn't built by humans, so there's bias built in it, then we're going to miss the opportunity. But I think what AI and machine learning do is they take in all the variables, more than our minds can possibly hold, and they help us make better decisions over time, whatever that decision is. For us and our technology, that decision is what's the best next step of care for you, based on where you're from, based on the issues that you've told us about. And so the great thing about that is that we can get better and better over time and less biased over time, because we're looking at all those variables which we just couldn't look at in the same way with the same level of complexity with individual humans evaluating those things. And now I think we have technology that can really work in our favor if you have conscious, aware people who are behind those systems. And I think we've really pointed to the need for those kinds of leaders at this particular juncture. So my hope is that those people are rising in the ranks, and we're part of a positive shift in that direction, given all the things we've had to face over the last several years, and for many people, lifetime.
Joshua or Jennifer?
Yeah, the one thing I would say that as you think about, everything we've been talking about today, right, which is support and having conversations and getting to the right people so that they can even give you the direction you need. When we think about what Aduro has been really focused on is not only the intervention, but how do we do it sooner? How do we do it before it's actually a dire situation? How do we look at all of the information that we have access to, also listening in a really great way to each individual member, and then intersecting with them with the right solutions at the right time? And you talked about that at the very beginning, Brad, and Jennifer, you've mentioned it a few times as well. And so we've been really focused on not only continuing to build out a suite of services and solutions around, right, meeting people with an authentic experience, but it's also very much what we've talked about around there is still a stigma associated with mental health. I mean, if you think about, I think each one of us are in cities, and probably many people on this session are maybe potentially in cities where they can be a dash more progressive, or maybe they have access to more resources. But, certain parts of the United States and even globally, mental health is still, it's spoken about in hushed tones. And so how do you meet people with that authentic experience? And so we're talking about coaching and advocacy. So a lot of what we're doing is, focusing on bridging the gap between individuals and care, individuals and chronic conditions, and how do we intersect with them earlier versus waiting to a place where it's actually a dire situation. And then the only possible way to intersect with them is medically and with medication and drug. How can we help them before they get there? So I think those are, some of the areas we've been focused on, but I'd be very excited to hear what Jennifer and her team are working on as well.
Yeah, those are both such great comments. And I think related to that, it's really around how do we get access to care to people in a way that's meaningful to them. Instead of asking them to engage with us in the way that works for us, how does it work for them, right? And there's some simple examples. We pivoted really quickly last year to move a lot of our care virtually, as many organizations did, and are now thinking about, in the new world, how do we allow people to get access to care more quickly? Joshua, you brought up a great point. Like, before it's a problem, instead of having to wait a few days for an appointment, can they see someone virtually now? Can we get them connected to a behavioral health specialist today, virtually, versus having to schedule an appointment 3 weeks out? How do we use data to then better inform that process and make sure we're getting people to the right intervention at the right time? So it's really an exciting time that I think puts the member and the person first with what they're dealing with in their lives. And I think the comments that Brad and Joshua made are just so tie really nicely into that concept.
Yeah, that note of personalization and making it feel as the member, the patient, the employee really is getting what they need is really important. Well, I'm gonna leave us with the last question, just about some advice, right? As the Culturati community is putting together their playbooks and looking at sort of how they're going to plan into this new hybrid work world, give us your, key negative advice on what a leader should really think about when they're trying to establish this systematic approach to well-being and care. Brad, you want to go?
Sure. I think the first thing that came up for me in that question is, as a leader, be really clear about where you are taking a stand and what are you standing for. I think one thing, I know that many people who are in HR, sure, they have the responsibility and oftentimes they're looking at a lot of these solutions, but they're in service of the company. So regardless of what is next to your title, whether it's associate manager or VP or C-level, when it comes to the well-being and care of your team, think about what you want to take a stand for and bring those ideas to your executive team. I think that at the end of the day, they're in service of the employees. And I think it's really important that leaders really use this time to be clear about what they have conviction on. What are the things that you're willing to fight for? And sometimes we can just coast. And I feel like if 2020 taught us anything when it comes to having more humanity at work, is just don't coast as a leader. There's just so many things that we all need and want. So that's a big one, I would say.
Yeah, I love that. Draw your line and know where you're going. Jennifer, what's your nugget of advice?
Yeah, I think a couple things come to mind. I think really just putting your people first and approaching whatever you're building with a sense of authenticity and empathy about what your people are facing related to work in their life. And think about it as a system and make it simple for them to use, so they know exactly how to get help and how to navigate whatever it is they're facing.
Make it simple. Love it. Joshua.
Both comments, or both the individuals and their comments, I think are spot on. I would keep it simple to three things. Number one is, how are you listening in the best possible way? If you're listening, that means that they have the opportunity to tell you what they're thinking. And do you have the right tools to listen? Second piece is engage with them. How do you create thoughtful, authentic engagement with your teams, with your organization, and how are you setting that standard and that culture? And then last but not least is, how do you help them activate? 9 times out of 10, the first step is I know I want to conquer something, and I know that I have the tools and the resources to do it. If I walked away with this, those would be the 3 things I'd want to focus on: listen, engage, and activate. And I think that that'll help build out some really great programs and the baseline for success. So that's my humble thoughts.
Well, I want to thank you all for your insights and your intention. Hopefully, our viewers really get a lot of value and some key nuggets to walk away, because this is a very important topic. And we're charting new courses as we move into this hybrid world. And I think that, if we just keep in mind about putting humanity and the individual at the center, I think there's going to be some great success as we move forward. So thank you all very much for your participation, and we'll get back to Culturati.